Today I'm going to be doing some joint mobilizations, and these are great for when you're working with patients such as TBIs or strokes. A lot of times they suffer from positioning issues and malalignment of joints. So these are commonly used to help restore that alignment and get better upper extremity function. And so the first one I'm going to do is scapular elevation and depression. And you're going to be sitting beside your patient, and you want to place your fingers on the spine of the scapula. And then can I get you to put your hands on top of here? You want to have both our hands weight bearing on the table, and then you support with your other hand on the front side, and you just lift the scapula up and bring it down. Up and down. Okay, and then the next one we do is scapular protraction and retraction. And you place the ulnar side of your hand on the medial border of the scapula and your thumb on the lateral border. And then I'm going to help her push the table forward. And for that protraction, we're going to get the scapula away from the spine. Then we're going to come back and bring it back towards the spine. So do that a couple times. Come back. Okay. So the scapula is obviously very important when you're wanting to get the upper extremity functioning better. So these are a great preparatory exercise for therapy. And then the next one we're going to do is we'll go down the upper extremity, and we'll do the interosseous stretches next. And these are a great way to loosen up the forearm and enhance supination and pronation. And there's actually 3 of these. And you wrap your hands around, you get one thumb on the ulna and one on the radius, and you just apply some traction. That. And you move down all the way distal. Again. So that's the first one. And the second one is you take it again, same hand placement, and you just retract medially and laterally. Okay. Okay. And that's that one. The last one you do is you hold it with this, with your left arm, and you supply traction up immediately. And for this last one, I'm going to have Shawnee act like she has a flexor synergy pattern in her hand here. And then this is derotating the carpal bones so we can get better wrist and hand function. And you come here and grab, and you just twist out her arm like this. And you can do a little metacarpal stretch. And once you have that, you can place your hand down and do circumduction of the fingers to help mobilize those joints, to help break up those abnormal synergy patterns. And one more thing you can do with the fingers themselves is you can do joint traction at each individual joint. Just go proximal and distal. And you just do that for each finger. That is joint mobilizations of the upper extremity.